Hello to our signing members. This is Katie Capps, co-founder and executive director of the Get the Medications Right Institute. I hope you all have been having a relaxing summer. Today, I'd like to give you a quick update on the Institute's activities and work underway as we engage and educate those who pay for care, those who provide care, and those who receive care to ensure that we get the medications right. Now, the Institute continues to tap into key thought leaders. Mary Roth McClurg, Executive Vice Dean, Chief Academic Officer, University of North Carolina, Eshelman School of Pharmacy, has been invited by our Board of Directors to join the Institute as a Distinguished Fellow. We are thrilled to have her expertise on board and look forward to more collaboration with Mary. She has been a strong and active supporter of our work. Welcome on board, Mary. Now, we continue our outreach to employers as health plan sponsors as well. Recently, the Get the Medications Right Learning Network hosted a webinar sponsored by AbbVie as part of the release of our Employer Toolkit. As you know, the toolkit was written by employers for employers, with over 10 of the nation's leading business coalitions, all members of the Get the Medications Right Employer Task Force, supporting our work. If you missed this webinar, we've published an issue brief, Comprehensive Medication Management. Employers hold the key to solving the $528 billion problem. I encourage you to read the issue brief, listen to the webinar, and check out our Employer Toolkit. Now, in addition to that, as part of our rollout strategy for the Employer Toolkit, we've also produced a new episode of our Voices of Change podcast, this time featuring Cheryl Larson, President and CEO of the Midwest Business Group on Health. MBGH is a nonprofit organization of over 130 mid to jumbo self-funded regional and multi-state public and private employers. Cheryl is also a member of the Get the Medications Right Employer Task Force. In this episode, Cheryl joins us to discuss how employers can work with their medical carriers and PBMs to get the medications right. After all, employers as health plan sponsors manage the health benefits for 49% of the country's total population. They can leverage their contract authority to bring about change and create a better medication use process for all Americans. You can listen to the episode on Healthcare Now Radio. If you've not tuned in, I strongly encourage you to do so. Now, as a follow-up to the GTMRX report released in June, Building Vaccine Confidence in the Health Neighborhood, the Institute continues to urge communities to build local vaccine confidence leagues to overcome vaccine hesitancy. Unfortunately, the cry and the desire to blame the unvaccinated is growing louder. We hear it from respected people across the political spectrum. We hear it from our vaccinated friends and neighbors. Now, I get that. We are in the midst of a crisis again. The highly transmissible Delta variant is spreading across the country. Hospitals are struggling. In fact, there's a part of me that wants to join in their cry because I am angry. I survived COVID-19 and I know people who died. I have every right to be angry. But as the task force recognized, blaming the unvaccinated is scapegoating them, and it would be deeply misguided. It would accomplish nothing and would actually be counterproductive. Our ultimate goal is to get everyone vaccinated, not to create a new class of outcast. If you haven't read it, please read my blog for actionable steps that we as members of the local community and health neighborhood can take to increase vaccine confidence. Now, on the subject of vaccines and building confidence in the health neighborhood, I want to draw your attention to an interview from Dr. Georges Benjamin, Executive Director of the American Public Health Association. Dr. Benjamin served as co-chair, along with Paul Abramowitz, of the GTMRX National Task Force Building Vaccine Confidence in the Medical Neighborhood. He was recently interviewed by Modern Healthcare's The Checkup, and he cited primary care as the key source of getting the public vaccinated. If you've not tuned into this podcast, I would seriously consider visiting our website and downloading the podcast. Now, on another note, as a GTMRX member, it's important that you know that we are working to raise awareness about the work of our volunteer membership. GTMRX has been in the news quite a bit recently. We've had a couple of different articles and interviews with GTMRX workgroup and task force leadership highlighting the work of the Institute and our workgroup task forces. Check out some of these articles, share them on social media. You will find them all listed on our website, and we look forward to your feedback. Now, the Institute continues outreach by showcasing our partners' efforts around comprehensive medication management. The Journal of Precision Medicine, a strategic partner of the Get the Medications Right Institute, recently published a commentary on precision medicine program, Humanistic Outcomes Are Always Key. The commentary was written by Jane Cheshire Gilbert of the Teachers Retirement System of Kentucky and a member of the GTMRX Employer Task Force and a member of our Precision Medicine Work Group. I would encourage you to read her commentary. I think you will find it enlightening. You know, precision medicine meets personalized medicine in places like the Teachers Retirement System of Kentucky, where they're utilizing pharmacogenomics testing as a successful tool in CMM services to deliver the best medical plan and outcomes for their retiree population. You can read the brief commentary for more on specifics of how TRS was able to drastically improve outcomes while also saving money. Recently, GTMRX partnered with Zogby Analytics to conduct a survey of over 1,000 Americans. Among the survey participants, 65% of people were taking 2 or more medications, with 23% taking 5 or more. If these medications are not properly managed, monitored, and evaluated on an ongoing basis, the consequences could be severe. Through the survey, we also found that 1 in 5 are being prescribed medications from 3 or more doctors that they have seen in the past year. Now, this leaves tremendous room for error, miscommunication, and medication mishaps. Survey results indicated that 1 in 4 say their medications are not routinely reviewed and evaluated by their medical team. Medication evaluation, review, assessment, and management to ensure that an individual's clinical goals of therapy have been met are essential to optimize medication use. The need for change is clear. Now, as a closing note about the survey, it's also important to note that 61% of respondents believe that it would be helpful to have a medication coach as part of their medical care team. We know that there's work to be done to educate consumers, providers, and payers about the urgent need to reform our medication use process. So look for follow-up surveys throughout the coming months. Now, not only are we interested in surveying consumers to get their insights, we're also releasing a set of consumer-focused tools, including a new consumer infographic which outlines a common patient story of addressing medication issues through the process of CMM. In addition to the infographic, we've created a 2-minute consumer explainer video educating consumers and others on the benefits of managing medications better. The explainer video is included in the employer toolkit, and it's also been added to the consumer tools that have been created. Visit our website to view these materials. They're free, and we encourage you to share them liberally. Now, in addition to this, we've been developing a set of tools and resources for various stakeholders. The Consumer Toolkit Resource Center can be found on the GTMRX website by following the link shown on the slide. Soon we will add consumer frequently asked questions to the toolkit. but you will find a variety of tools available for your use and for sharing. In addition to the Consumer Toolkit, there are also additional tools that aren't so new, but they're just as relevant. I want to draw your attention to some of our other resources and resource centers that will aid you in educating various stakeholders and groups on CMM. We have the General GTMRX Learning Center, which features our foundational report, weekly news briefs, and our blogs. In addition to that, we have a resource center that includes the Blueprint for Change. If you've not visited our Blueprint for Change Resource Center, I encourage you to do so now. This is the guidance document we released last year, offering policy direction. Now, in the Resource Center, you'll find the full GTMRX Blueprint for Change, an executive summary, frequently asked questions, use cases, infographics, and a chart pack that can be used in your social media channels. Again, we encourage you to visit the Resource Center and use those materials as you educate stakeholders within your local community. Another stakeholder resource center is the Employer Toolkit Resource Center. It's geared toward employers as health plan sponsors, featuring our toolkit as well as frequently asked questions, an employer-directed infographic explaining the value of CMM in managing misuse, overuse, and underuse of medications, while at the same time offering employers information on how they can decrease waste and manage cost. In addition to that, you'll find guidance on how to use pharmacogenomics testing along with CMM for better outcomes, saving lives, and saving money. There's a helpful guide on contracting for CMM, and then evidence documents and use cases, as well as consumer education tools. And finally, our newly released toolkit, the Vaccine Confidence Resource Center, is also available on our website. It includes two very important reports: a March-April background report on overcoming vaccine hesitancy or building vaccine confidence, as well as frequently asked questions. The June 2021 report, which offers a set of short-term and long-term recommendations, is also included in that resource center. This work was sponsored by J&J, and we appreciate their support of this initiative. Now, GTMRX is also participating in several conferences over the coming months, and we encourage you to join those conferences that you might be interested in. They're virtual conferences and face-to-face conferences. At the end of this month, I'll be presenting along with Jennifer Hawkins, PharmD, the pharmacogenomics clinical specialist from our strategic partner, the Cleveland Clinic, at the Precision Health Virtual Summit. You will find registration and a registration link for that on this slide. Registration is free. In addition to that, other GTMRX members will be presenting at the same summit. I encourage you to tune in. In September, Sandra Morris, a senior advisor to GTMRX, will present at the Pittsburgh Business Group on Health's 2021 Stewardship event. This is an informational live event in Pennsylvania for employers as health plan sponsors. At the conference, they'll address health inequity, mental health, and quality care. I encourage those of you in the area to participate at that meeting. Now, on the following day, on September 10th, I'll be presenting on the value proposition for getting the medications right at the Pennsylvania Society of Health System Pharmacists Ambulatory Care Summit. This event will focus on the effort to expand pharmacist engagement and ambulatory care in Pennsylvania. I'm looking forward to being part of that opening session. Later in the month, on September 21st, I will be moderating a panel on unlocking real-time drug therapy opportunities to achieve better outcomes at lower cost. GTMRX has invited Amanda Brummel from Fairview Pharmacy Services and Dan Rearauer from Health Partners to join us in a panel to talk about their innovative programs. Other keynote presenters include Liz Fowler, CMMI Director and CMS Deputy Administrator, and Mark McClellan, Director of the Robert Margolis Center for Health Policy at Duke University. Now, we also have upcoming GTMRX Learning Network webinars that I would like to bring to your attention. Next month, GTMRX will be hosting 2 GTMRX Learning Network webinars. The first will be held September 16th from 1 to 2. Kathy Pham from the American College of Clinical Pharmacy and Ann Greiner from the Patient Centered Primary Care Collaborative will present on alternative payment approaches for advancing comprehensive medication management in primary care. Look for registration information. Then on September 22nd from 1 to 2, Amy Brooks from ACCP will moderate another Learning Network webinar featuring presentations from Dr. Annie Eidecker of Health Partners and Mary Roth McClurg from University of North Carolina Eshelman School of Pharmacy. Their webinar session is entitled A Better Way to Manage Medications. Again, I encourage you to register for these sessions, so look for follow-up information. Now, finally, I'd like to thank all of the companies that you see here who have come on board to help fund the Institute's activities as founding funders, executive members, and strategic partners. We couldn't do our work without your financial support. Now, as we continue to grow, organizations have joined the Institute over the past 3 months as funding supporters, and I'd like to welcome them as well. NPRX and Curator are the latest companies to join the Institute, and they are joining us in our mission to advance team-based, patient-centered care that will optimize medication use through CMM in practice. And with that, I thank you, our members, for taking time to listen to the Get the Medications Right Institute update. Until next time, be well.